Welcome to Perimenopause. In this video, we're going to talk about the phenomena of clitoral atrophy, which is what happens to our dear old beans when we get old. So in this presentation, we're going to look at clitoral atrophy as part of vaginal atrophy. We'll be looking at women's lived experience of clitoral atrophy, what they have to say about what happened to them. We'll be looking at misogyny in the medical establishment, the assumption basically that our pleasure and the clitoris is of no importance, and how medical books have shown incorrect diagrams of the clitoris, and there's been poor coverage of these problems in the medical school curricula. We'll also be looking at Jessica Pinn's campaign to redress the balance, and the interesting phenomena of Miss Pinn denying that such a thing as clitoral atrophy exists. So I run a patient-led perimenopause support group. There's 25,000 women in there. I'm also in other groups about vaginal atrophy, and I suffer from it myself, and I have lichen sclerosis, which is another skin disease that affects the vulva. So having researched vaginal atrophy myself and discovering that it affects 50% of women, it struck me that many of the complaints that I was hearing from perimenopausal women about loss of sexual sensation could be down to the atrophy affecting the clitoris. And I was able to establish that that is the case. So as I've said, 50% of women suffer from vaginal atrophy, and low estrogen levels in later life cause degeneration of all vulvar and vaginal tissues. The clitoris is not magically excluded from this. So if we look at vulvar vaginal atrophy, it affects the vagina and the cervix. So when estrogen becomes very low, the vagina becomes dry, the rugae, the characteristic folds, flatten out, and the cervix can actually close up. That's called cervical stenosis. The urethra and the bladder often become inflamed and affected by the lack of estrogen. That can cause urinary symptoms such as incontinence and a feeling like having a urinary infection all the time. It can affect the vulva, including the labia and all of those structures. So really, it would be rather strange if it did not affect the clitoris. So the work Jessica Pinn has done to educate people on the actual facts of the size of the clitoris and, what we can see from the exterior is only the tip of the iceberg, as in the tip of the clitoris, okay, is what you can see and what most women stimulate to get pleasure and to orgasm. So, but this is what you cannot see in terms of the structure of the clitoris that is hidden. It's actually really quite a big structure. And Jessica has been campaigning for the correct recognition of the size and the structure and the dimensions of it and where the nerves go that supply it. I did look for research about clitoral atrophy, but I could only find one study of 3 women. It seems that the majority of the research about clitoral atrophy is lumped in with vaginal atrophy, which on the whole is sensible, but it makes it kind of hard to dig out. So, like many aspects of women's sexual health and menopause, it is underfunded and largely ignored. So this was the study that I found, and they said in the study that basically it was a neglected cause of female arousal complaints, as in a reason why older women could not become aroused or orgasm, and it was treated in this study with localized estrogen, despite there being a lack of data for the use of these agents, and all of the patients reported improvements. And this is exactly what we suggest to the women in our patient-led support group is that estrogen cream can be used directly upon the vulva and clitoris. So we looked at another study that was called the treatment of vaginal atrophy, and this did mention the clitoris. It also talked about reduced orgasm and subsequently lower interest and libido. So basically, the symptoms of vaginal atrophy were very badly affecting women's sexual pleasure in later life. So it said the visual changes of VVA include dryness, redness, loss of rugae, pallor, petechiae, phimosis of the clitoral hood, friability, and stenosis. This was another thing that has been talked about by various women, is that the hood of the clitoris becomes stuck and it becomes actually very painful as a result of these changes. There was another study that I looked at where they had used testosterone therapy. I have actually read that the body can convert testosterone into estrogen sometimes, so perhaps that's why this works. I don't entirely know, but in the study they'd said that the genitalia of a woman with low levels of androgen sex steroids, they're talking about testosterone in this case, may reveal clitoral atrophy and phimosis. So maybe either one or both of those problems. Sex steroid hormone changes may lead to such clinical complaints as dyspareunia, diminished sexual interest, and diminished orgasm. So once again, pretty much ruining the sexual experience of older women. I spoke with 40 women diagnosed with vaginal atrophy. All of them had experienced problems with the clitoris. The majority experienced shrinkage, loss of sensation, and inability to orgasm. Some experienced pain from phimosis. And treatment with topical hormones helped in all of the cases. These women were using creams, pessaries, estrogen, testosterone, and DHEA in some cases. They were very well educated about their problems and what was happening to them. So, to quote from these women, topical hormone cream estradiol applied nearby, not directly on clitoris, restored my clitoral hood completely, took a few months, and also partially restored the clitoris itself and helped with bringing back orgasms. More importantly, about changes of sensation, I discovered that my sweet spot had moved away from the clitoris, moved south, and once I found that new spot, I had better luck having orgasms again. So another woman said, mine retreated and the hood fused shut. It happened quickly. I wish I had known that something like that could happen. Another said, it affected the sensitivity hugely and numbed the area. Achieving orgasm became just too difficult to manage. Another said, I can't even find mine now. 5 weeks ago it was still normal size. How the hell can that happen so quickly? I feel like a freak. I think that's really sad, actually, that anyone should be made to feel like a freak by something that is a natural part of aging, if an unfortunate part of aging. Another said, it's tiny now too. My labia shrinking in length has brought it down with them. I didn't tell anyone for years. That's just so sad, considering the treatment is really easy. I can't tolerate any of the treatments I've tried so far. Presume it will just get worse. And that also is true, that some women are very sensitive to all of the ingredients in the products and they just can't tolerate them. I fixed it with nightly topical application of Hyalofem from Amazon and Ovestin. All external genitalia now return to premenopausal appearance and performance. Many of these women are in their early 40s and distressed to find that their sexual life is adversely affected at such a young age. The youngest woman I spoke with was 32. Problems tolerating the creams and adverse reactions, for example, burning and stinging, are relatively common. I would think that undiagnosed lichen sclerosis is a distinct possibility in some of these cases. So they would also need a steroid cream. In the course of my research on this, which albeit is anecdotal and not up to any medical standard, I came across this lady, Jessica Pinn, who goes by the name of Mediclit on Twitter. Jessica came to my attention via social media, where she leads a campaign for education about the clitoris, basically the dimensions of and the nerve supply of the clitoris having been misrepresented over the years in anatomy books and medical literature. So this is Jessica's profile on Twitter, so you can find her yourself. I'd followed Miss Pinn's campaign with interest, and on the whole she's doing very valuable work. I had wrongly assumed, though, that she would be aware of the phenomenon of clitoral atrophy. So I tweeted her twice to ask if she had any learning materials on the topic, and I didn't get any reply, which I thought was strange. I did leave a certain amount of time after each tweet to allow her to reply, but she didn't. So then I sent a message, and what happened next was really quite distressing, and I wasn't expecting it at all. You can stop the video, read this if you want. She said she didn't know anything about atrophy, and she said that people say the clitoris gets bigger with age, even though she hadn't found any evidence for such in the research. She openly admits that there isn't much research of any type, and that's why she does what she is doing, which is good, but at the same time not good that she's denying that this exists. I did send her a number of a video that is on our YouTube about atrophy and includes references to clitoral atrophy. She didn't really seem to watch it. So she said that there's nothing about clitoral atrophy in medical literature. You know, I think Jessica's quite capable of using Google, and I couldn't really work out why she was, saying are there studies about this? Is there any data on it? Blah, blah. I don't expect to have to spoon feed somebody who is running a campaign. So I did send her a study about it. I expected that she could find others. And basically, I said to her that I felt that I was wasting my time having any more of a conversation with her. It was really sad. So it's no wonder women feel they can't talk about it. It's not really unusual for women's pain and problems to be dismissed, but it's infinitely worse when other women do it. So I'm really upset. I was really upset about the whole of this dialogue. I found one of Jessica's studies that she's been involved with. Part of the conversation we had on Twitter, I asked her if she was a doctor because it wasn't clear from her profile that she appears to have some sort of medical education, but I don't think she knows much more than I do, to be honest. Her qualification appears to be Bachelor of Science. This study that she had been involved with was an anatomical dissection of the dorsal nerve of the clitoris and appeared in Aesthetic Surgery Journal. So basically what they were doing was dissection of cadavers to discover the true dimensions and the innervation, i.e. what nerve supply the clitoris has. And interestingly enough, all of the cadavers that they dissected, all these women were almost all over 60 years of age. But none of them, including the other 3 medical doctors that were part of this study, had actually mentioned whether these women were on HRT or if they had experienced any type of atrophy. No one had even thought about it as affecting the size of the clitoris. So really it does potentially affect the results of this study that they hadn't even considered this. So they've said it is unclear what implications this has, as no known publications have established a relation between age and clitoral morphology, but somehow they didn't know about atrophy. Now, I discovered in due course that the reason that Jessica Pinn had become interested in the topic was because she'd been the victim of a botched labiaplasty. What that is a procedure to reduce the size of the labia for cosmetic regions, and she was sadly left with no feeling in her clitoris after the procedure. They must have cut through some of the nerves, and in fact they had reduced the size of her clitoral hood without her permission, which must really have been dreadful, and I'm very sorry about that. And women's pain and pleasure are too often dismissed by the medical establishment. But one thing that does bother me is that Jessica's still quite a young woman, so I suppose she hadn't even considered menopause, and it just shows you how neglected that subject is, really, that even the woman who is the champion of the clitoris hasn't considered that. Perhaps being so interested in cosmetic surgery, perhaps age is too ugly a subject for her. I don't know. I felt very upset about our exchange. So, anyway, that's the end of this presentation. I hope you found it interesting, in which case you can like and subscribe. The link to our group is in the description box below. We now have Facebook, MeWe, and Twitter. Thanks very much for watching. Cheerio.